Dairymen are often asked to collect milk samples from their cows to determine which ones are contributing to the herd mastitis problem. For example, if a bulk milk analysis shows an elevation in somatic cell count and a differential bacteria count shows numerous colonies of Staph aureus, then it's likely that there are one or more cows in the herd with Staph mastitis. Such infections are associated with very high somatic cell counts, and the infected quarters are shedding Staph bacteria into the bulk tank. Cows infected with Staph may be spreading these bacteria to uninfected cows, increasing the herd level of mastitis and further elevating the bulk tank somatic cell count. To collect quarter milk samples, the following sequence is recommended to minimize contamination of the sample by bacteria in the cow's environment. Have your test tubes racked and labeled with the cow number and quarters to be sampled. For example, these tubes are dated and labeled with the cow number 1200 and the right front quarter, followed by the left front, left rear, and the right rear quarters. After the cow was prepped for milking, such as forestripping, pre-dipping, and drying, and prior to machine attachment, samples should be collected. It is important to wear disposable gloves. These minimize the transfer of bacteria from quarter to quarter and from cow to cow, as bacteria stick less to plastic than to bare hands. Prior to sampling, each teat orifice should be sanitized with cotton swabs soaked in 70% alcohol. To avoid contaminating teat ends with bacteria that may be present on your gloved hand, you should sanitize far teats first, followed by near teats. For optimum sanitization, it's necessary to scrub the orifice vigorously, using a clean cotton swab for each teat. After teats are sanitized, samples can now be collected. I am holding the test tube cap using the baby finger of my left hand, open and down. This will prevent bacteria falling off the cow's teats from landing in the cap. I will start with the right front quarter, followed by the right rear. After filling the tube, the cap is replaced and snapped tightly onto the test tube, which is placed in the rack. Now the right rear quarter will be sampled, again filling the tube to within 1/4 inch of the top, snapping the cap in place and racking the tube. Now it is safe to collect from the left side, so I will begin with the left front quarter, fill up the tube, cap it, and place it in the test tube rack. And lastly, the left rear quarter is sampled, capped, and racked. Once all samples are collected, the test tube rack is placed on ice in a cooler, which inhibits the growth of bacteria. If milk samples are to be processed that day, they can be stored in the cooler and then transported to the laboratory. Most likely, it will be several days until samples are processed, so the test tube rack and samples can be stored in a freezer and transported frozen to the laboratory for processing at a later date. Freezing causes the milk to expand, and tubes filled to the brim will cause the cap to pop off when the milk freezes. So it is wise to fill within 1/4 inch of the top to allow for expansion. The culture of quarter milk samples can be very valuable in locating those subclinical infections causing herd mastitis problems. By following the preceding directions, you can be sure that the microbiologist has a properly taken milk sample that will identify problem cows and quarters. This will be instrumental in solving milk quality and mastitis issues.